Hello, I'm Asma Ahmed. I'm the Children and Young People's Network Coordinator with VOSCA. I attended the last meeting of the Bristol Children and Families Board on the 14th of November and just wanted to talk about what was discussed briefly. So the board is the multi-agency board looking at services for children and young people and families across Bristol. It's chaired by John Redman, who's the Strategic Director for People, and we've got representatives from police, public health, schools, education, and plus others. The board looked at the draft terms of reference and agreed some changes, so they're going to be coming to the next meeting. There was also a presentation from Gary Davis on the Troubled Families Programme. The programme's been extended to 2020, and Gary presented some data on the number of troubled families coming under the 6 criteria that are needed for that. There was some discussion around how the funding should be targeted. Should more go into prevention, early intervention, or should they be trying to reach less families but with meeting more criteria? And there's also a discussion around data, the fact that there's quite a lot of health visitor data. There's a gap in that, and that needs to be chased up. It was agreed that it would be good to take a holistic whole family approach, and prevention would be really good, but more discussion is needed around that. There was a discussion around what does children in need include, and it includes children that may be under threat of homelessness as one criteria. There's also a discussion about public health, the fact that it's working to address the wider determinants of health, and again, prevention is the main aim, as well as early intervention. There was a bit of information about the Children's Community Health Commissioning of services, and there's a delay to that, so new services won't be starting until April 2017. Finally, there was discussion around performance indicators for services. It was agreed that that the board would be having a work plan in place by the end of March, and performance indicators should include things like progress towards the number of education, health and care plans that have been completed as part of the SEND reforms, and also the reduction in the number of do not attends for the CAMS service. I gave a brief verbal update on the recruitment of ECS advocates. So the recruitment process is currently underway. So if you can actually have a look on the website and put in nomination after reading the information, that'd be great. And next meeting for the Children and Families Board is on the 9th of January 2015. Thank you.